Okay, good morning, everybody. Dear colleagues, ladies and gentlemen, thank you for joining us today in this important discussion. I also thank your association, the United European Gastroenterology, for its work in defense of health. Today, we launch our interest group on digestive health. It's a great pleasure for me to chair this group. We start with the prevalence of digestive disease. Digestive diseases are one of the biggest killers in the European Union. Digestive cancer are responsible for 300,000 deaths in the European Union. Unfortunately, this number is expected to increase in the next few years. Today, one European citizen dies every 3 minutes from colorectal cancer. Each year, we register 600,000 new cases of digestive cancers in Europe. Digestive diseases are a public health issue. This is why we must act and improve their understanding, prevention, and treatment. As the European population ages, the burden of digestive disease will inevitably grow heavier. We have a responsibility to not only help patients, but also to prevent people from getting sick in the first place. Way forward. This platform will unify our efforts. This is essential to coordinate scientists and doctors' actions. Half or more of all cancers could be prevented by a healthy lifestyle. This is the key for the future. I believe that this interest group must be an important voice in this direction. Together, we will ensure that the continuous improvement of digestive cancer prevention and treatment is part of the EU health agenda. Prevention is a public health responsibility. It should be our priority. This is well reflected in the EU's Farm to Fork strategy and in Europe's Beating Cancer Plan. I welcome the Commission's work on this. However, there is still a long way to go. The next few years are crucial. Considering the link between nutrition, lifestyle, and obesity, we must invest in research. It is also fundamental to invest in promoting healthy lifestyles, especially from children. Legislators have a critical role to play in promoting cancer prevention and early diagnosis. A new alliance between health professionals, universities, research centers, institutions, and industries is necessary. Only in this way we can improve public health care across our continent and ensure the well-being of our citizens. Together, we will ensure that the continuous improvement of digestive cancer prevention and treatment is part of the EU health agenda. This digestive health group is a cross-party platform. We already have supporters from different EU member states. Thanks to the effort that we are doing today, future generations will benefit from better health-related policies. The group's mission is to ensure a useful exchange between the scientific community and policymakers. We want to raise awareness of chronic digestive diseases. We also need to spread information on the importance of healthy nutrition and the reduction of alcohol-related problems. We are aware of the importance of chronic disease and the socioeconomic cost. It is necessary to share this knowledge amongst European citizens. This way, we can help them to make better health choices. I count on my colleagues in the European Parliament to bring the European added value in this field. Unfortunately, some of them cannot be here today. However, they fully support the MEP Digestive Health Group. We must work in the interest of European citizens and patients. Now, I give the floor to my colleague Christian Silvio Busoi, Chair of the Committee on Industry, Research and Energy. After him, we will listen to Professor Marcus Peck, Chair of the UE Public Affairs Committee. Mr. Busoi, the floor is yours. Thank you.
Grazie molto, Presidente. Thank you so much, President Tajani. I would like to thank and express my gratitude that I was invited today. Dear Chair Tajani, dear colleagues, distinguished speakers, Professor Peck, Professor Ricciardiello, it is really a pleasure to be here today and witness the launch of MEP Digestive Health Group. I very much welcome and resonate with the mission of the MEP Digestive Health Group to improve digestive health by awareness raising and the promotion of related policy initiatives, especially that tackling obesity is one of the areas in which I was very active, and also addressing liver diseases and cancer remain one of my main priorities, and I have the joy to work closely with Professor Peck in the past on issues related with liver diseases. Indeed, as President Tajani mentioned, digestive diseases pose a massive challenge. Digestive diseases causes a significant healthcare burden, high societal costs, difficulties for patients, and ultimately, unfortunately, shortens life. Often digestive diseases are linked with bad nutritional habits, poor diets, and obesity. For example, obesity in children is linked directly with pediatric digestive diseases, and fatty liver disease is one of the most significant complications of children obesity. Dear President Tajani, I would like to thank you for having this initiative. I would like to thank all colleagues which will be part of this group. This interest group it is extremely important because we have the chance via meetings and events that we organize together to support this agenda, to use all the opportunities and also to raise awareness. Because the opportunities are here, we have the Youth for Health program. I am the rapporteur of European Parliament for this very important program, 5.1 billion euros in the next 7 years in order to make our health system more resilient, but also to fight better against diseases that are complicated so much our lives. And also, of course, as President of Industry, Research and Energy Committee, I should mention the opportunities bring by Horizon Europe. Horizon Europe being the most ambitious and well-funded from public funds research program in the world. Here, I'm sure that distinguished professors and experts that are following us today will find important opportunities for their research. And this is an opportunity that we should not miss. I wish you great success. I will follow the works, and I'm sure that the MEP Digestive Health Group will be a very significant success. Thank you so much.
Thank you very much, Busoi. The next speaker is the Professor Marcus Peck. Professor, the floor is yours.
Thank you very much. A great thanks to you, President Tajani, and also MEP Busoi for joining us today, especially President Tajani, who is chairing the group, and we're really greatly honored and very thankful that you can do that together with us. Now here, I'll give you a short overview about the work of UEG. UEG is a scientific umbrella organization aiming to improve digestive health, and we're uniting about 30,000 specialists from every field of digestive health. So when we look at digestive health, chronic digestive diseases are long-term disorders of the digestive tract and include digestive cancers, chronic liver disease, inflammatory bowel disease, celiac disease, food allergies, functional disorders such as irritable bowel syndrome. And digestive diseases continuously inflict a heavy healthcare and socioeconomic burden throughout Europe because they often affect patients at young age and have a significant impact on society, resulting in a loss of economic productivity through both physical and mental burdens. Now, key contributors to the alarming increase in prevalence of digestive disorders include the aging population, environmental factors, unhealthy diets, including foods high in salt and fats, lifestyle factors such as alcohol consumption, smoking, and lack of exercise, inefficient primary prevention, diagnosis and treatment programs, and lack of research funding into diagnosis, prevention, and treatment solutions for digestive diseases. So here you can see a graph about the prevalence of digestive diseases across Europe. Digestive cancers are responsible for about 28% of cancer-related deaths in the EU, and the cost for colorectal cancer treatment is about 30 billion euros per year. Chronic liver diseases has been estimated to affect almost 30 million people in the EU, and IBS, not a deadly disease, but a very troublesome disease, affects about 1 in 10 people in the EU, so it really has an enormous burden on our healthcare system and on people's well-being. Next slide. Now, nutrition, obesity, and the digestive health. This has already been mentioned both by MEP Tajani as well as MEP Bourgeois. A multitude of digestive diseases have been attributed to unhealthy diets, malnutrition, and obesity, and are consistently linked to digestive cancers, inflammatory bowel diseases, and celiac disease. NAFLD, non-alcoholic fatty liver disease, is the most common liver disorder in Western countries and has become a public health concern worldwide. And studies demonstrate that obesity can increase the risk of colorectal cancer by 50%, particularly in men. And here, MEP Bourgeois already pointed to that digestive health in children is really, really important because it's the next generation. And if you get a bad start, this might hold on throughout all of your life in the future generations. Here you can see overweight in children. About 30% of children are overweight. So 1 in 3 children in Europe in school age are already estimated to be overweight. And here, important and early action is needed for a long-term benefit. Alcohol and digestive health. The European region has the highest level of alcohol consumption in the world, and as a result, the highest proportion of total ill health and premature death linked directly to alcohol. Alcohol consumption is a risk factor in over 60 types of diseases, with nearly 25% of deaths from GI diseases directly attributable to alcohol. So about 50% of all liver cancer cases, for example, in Europe, can be attributed to alcohol. 1 alcoholic drink per day increases the risk of esophageal cancer significantly, and between 1 and 4 alcoholic drinks a day increase the risk of colorectal cancer. So there is a great link, not only with cirrhosis of the liver, but also with digestive cancers. And you see the 5 most common digestive cancers in the EU are colorectal, gastric, pancreatic, liver, and esophageal cancers. And as said before, 28% of cancer-related deaths in the EU are attributable to GI cancers. And more importantly, approximately half of all cancers are preventable, and their significant burden could be reduced by addressing lifestyle factors such as alcohol consumption, smoking, diet, and exercise, and through the widespread implementation of screening programs. Functional GI disorders have been mentioned. There are a group of chronic and recurrent GI conditions where symptoms and treatments are not easily identifiable, like irritable bowel syndrome, constipation, functional dyspepsia, and as said, about 1 in 10 people in the EU are affected by these disabling conditions that have a major social and economic burden. So here, when we look at colorectal cancer screening, one of the more important issues that the EU Commission wants to address in this legislature here are the OECD data, health statistics, screening and survival for colorectal cancer. You can see that the colorectal cancer screening programs are highly heterogeneous throughout the EU. with countries like the Netherlands leading with about 70% of the population screened, while other countries, and we're not necessarily talking about just Eastern European countries. Look, for example, at Spain, that has a very, very, very low and incredibly low screening rate for colorectal cancer, with the resultant negative impact on colorectal cancer cases. Also in the lower panel, you can see the improvement in 5-year survival for colorectal cancer, how it changed over the periods. And you can see that in countries, for example, like Italy, over the period of 10 years, there was an improvement in colorectal cancer survival, 5-year survival, 64%, and improvement in the last 10 years, while in other countries, for example, Romania here, your survival is only 52% at 5 years and no improvement over the last 10 years. So there's great heterogeneity and there's important action for policy here. Health expenditure relative to GDP is also very, very different amongst different countries. I'm just highlighting here my home country, Austria, where about 10% of the GDP goes into healthcare, while on the other hand, another up and coming big country in the EU, Poland, has just 6.2% of its GDP going into health expenditure. And that, of course, creates great differences in healthcare delivery, prevention, and screening programs between those countries. Next slide. And when you look in particular at digestive diseases, you can see that, of course, a lot of money is allocated to different disease areas. Circulatory diseases, cardiovascular money, and that is probably also justified. But you can see that actually digestive diseases that are so prevalent are getting a relatively smaller share of budgets for treatment and prevention. And therefore, we do believe that political action is needed to put digestive diseases further up on the list when it comes to research and patient care. So, to sum it up, rising to the challenge, Europe is currently failing to manage the increasing burden inflicted by chronic digestive diseases. And despite their prevalence and impact, many digestive diseases remain poorly understood, attract too little political attention, and can be extremely underfunded for both research and patient care. UEG and the Digestive Health MEP Group thus calls for urgent steps to be taken to improve awareness of chronic digestive diseases, to put digestive health firmly on the EU agenda and reverse the current trend. Thank you very much. And with this, I will hand over to Professor Luigi Riccardiello, who is the chair of the UEG Research Committee, and he will give you an update in his area. Luigi, please.
Thank you, Marcus. Good morning, everybody. I'd like to thank also President Tajani for chairing the UEG, for chairing the Digestive Health Group. And of course, I'd like to thank also MEP Buzoi for joining us today, and all the other MEPs who have decided to join the MEP Digestive Health Group. Professor Peck presented the important burden of digestive diseases across Europe. In order to halt the rise of digestive diseases, we need to invest in research to better understand, prevent, screen, and treat these diseases, and to improve the quality of life of our patients. So with the start of Horizon Europe, we believe that the MEP Digestive Health Group and UEG could work together to ensure that significant research funding is allocated to digestive health. I will present some of the main research gaps which we identified and require European funding through Horizon Europe. In the meantime, the UEG Research Committee has commissioned the publication of the new White Book that will provide an in-depth analysis of major research gaps, and the results will be available at the end of next year. We also very much welcome the Mission on Cancer and the Innovative Health Initiative. We hope to see concrete research funding for digestive health and especially for digestive cancers in these initiatives. Now, unfortunately, our understanding of many digestive diseases is still incomplete for a number of highly incident diseases. For instance, the development of inflammatory bowel diseases, celiac disease, chronic pancreatitis, functional gastrointestinal disorders, as well as many types of cancers, including hepatobiliary, is still not fully known. There is a rise of newly diagnosed colorectal cancer cases amongst young people, and we stress the importance for further research into the understanding of the increase of young onset colorectal cancer. Functional gastrointestinal disorders, as we explained here as the gut-brain axis, represent a great burden in terms of quality of life and healthcare costs, and to improve the lives of people with functional gastrointestinal disorders and to improve, optimize patients' outcomes, there is a need for a greater recognition of the disorders and advancement of their scientific understanding. Finally, incidence of pediatric inflammatory bowel disease continues to increase rapidly, and further research is needed to understand the complex physical, psychological, and social needs of children with IBD. Propose tailored care and services, enable the development of effective treatments and prevention strategies, and understand the causes through research into early life programming. Now, of course, due to the projected rise in unhealthy behavior and the aging population, the health-related and economical burden of these diseases will rise simultaneously. So fostering research on prevention is essential to decrease this burden. Due to the growing evidence of the link between nutrition in early life and obesity, we must prioritize research into the underlying mechanisms and focus our resources and training on novel targeted prevention strategies, including those initiated during pregnancy and early childhood. Now, we understand that diet is a major determinant of the gut microbiota composition. It has been shown that certain microbiota compositions can have a role in tumor development. Thus, understanding how the microbiota composition is involved in hepatodigestive cancer development and the response to treatment, we believe is important. We also support the ambition of enhancing research on public health policies and inequalities to provide strong rationale for regulations and to policymakers. As Professor Peck also described before, screening programs are critical for the improvement of sustainable healthcare systems. Although colorectal cancer screening programs have been implemented across Europe and have worked in those countries where they have been implemented many years back, participation rates vary widely, affecting treatment efficiency, survival rates, and impacting the high annual cost of colorectal cancer care across Europe. As you heard, it's up to 13 billion euros each year. The number of diagnosed colorectal cancer cases is predicted to grow in the next decade unless significant action is taken to better identify and understand the barriers to the participation in screening programs. Furthermore, screening of upper digestive cancers, in particular esophageal and gastric cancer, particularly in high-risk individuals and of high incidence European countries, should be considered with innovative and adaptive tools. So this should be implemented and improved through better identification of patients at risk by means of robust biomarkers which should be developed. Importantly, further research should focus on the exploitation of artificial intelligence, big data, and machine learning, and next-generation screening markers in gastroenterology, including liquid biopsy, microbiome metabolome biomarkers, to cite some, with the aim of increasing early disease detection and the personalized treatment. Also, comprehensive high-quality data on preventive, diagnostic, and therapeutic activities throughout Europe is needed in order to further improve patient care and advance clinical studies and rational clinical decision-making for cancer patients. And finally, I would like to underline the issue we are facing today with pancreatic cancer. Pancreatic cancer represents a huge challenge due to its biological aggressiveness, late diagnosis, and lack of effective treatments. It is the fastest rising cancer in terms of mortality. Thus, research in this field is also a huge opportunity for advancing our understanding and boost patient survival. And we therefore need to focus on defining persons at risk for screening strategies, enabling earlier diagnosis, optimizing therapy sequences and multimodal treatment, overcoming resistance to targeted therapies, focusing on a patient-centered view in pancreatic cancer care. We are deeply thankful for the future work that the Digestive Health Group will carry together with UEG, and I'm very much sure that this will lead to significant changes in diseases that affect a huge proportion of Europeans. And thank you for your attention.
All right, thank you very much, Luigi. A great overview over research, which is of course very, very important. Now here we have some questions in the chat. And I think the first one is directed towards our President Tajani. The question is, do you think the EU should have greater responsibility for public health?
Okay, thank you. The lack of European coordination is a problem for our citizens. The current COVID pandemic shows that we need solutions if we want to solve new problems. Virus and disease do not have borders, unfortunately. If Europe is weak, health and economy are in danger. In this, the European Parliament will always be ready. As an example, we called for the EU for Health program of more than 5 billion. We were able to find an agreement for an ambition Horizon Europe program with a 95 billion budget. The integration project started with the common management of coal and steel. Today, we must rebuild our Europe, starting by a health union. We must give more power and responsibilities to the European Medicines Agency and the European Center for Disease Prevention and Control. Of course, we will work hard for this health union. I think after the coronavirus, we need to work with more coordination at technical level and a political level.
Great, thank you very much. This is what we wanted to hear, Mr. President. Luigi, there's a question for you here. Thanks for the presentation. Do you plan to do research on the role of nutritional care as part of the patient pathway and quality of life?
So UEG is very much looking forward to boosting funding for research in nutrition. And I think, you know, researching and collecting funds for doing much more research on nutritional care as not only a a part of the patient pathway, as you know, the panelist the audience was alluding, but also for the quality of life, I think is imperative. And this is also important for the aging population. We have to find better way of having our citizen, following correct nutrition.
Yes, I agree with you. Here's a comment, probably for myself, for the Public Health, the Public Affairs Committee. The European Federation of Crohn's and Ulcerative Colitis Associations, FCCA, that is representing 45 IBD patients associations, is quite happy that we're launching the MEP group, and they are delighted to bring patient experience and competencies into the debate and work together to raise great awareness in the wider audience. And I'm happy to hear that, because for Peck, in our advocacy work in Brussels, the patients and the patients organizations have always been an integral part that were always coming along with us, and we need their support. And we are very happy to hear that you will continue to work with us in our advocacy work in Brussels. Now here there's another question or a little bit of a critical question on research in public health policies. The person here writes that the Council recommendations on screening for colorectal cancer from 2003 have still not been implemented throughout Europe, and whether there should be more action that will impact citizens than academic research that does not translate into patient benefits. Now, I think this is actually, and Luigi, maybe you agree with me here, that this is actually two different things. We need the research, we need the data to have arguments, and then of course we have to feed back to the political side of the debate, and we need our politicians, of course, to translate this into actions. But my strong belief is that we need both. We need the research and we need the political action.
I completely agree with you, Marcus. We need more research, understanding, how the research programs have worked, but also we need more research on finding new and improved screening tools. And of course, there is another level that goes with the, the implementation throughout Europe that goes with policymakers.
Yes, excellent. So, well, here's another question. What about patients associations? I think I mentioned that just now, that patients associations are very important, and they have been working with us for many years, and I'm hopeful that they will continue working with us in the upcoming years. So I think with that, I will hand back to President Tajani to sum it up and give us some final words.
Thank you very much, Professor Peck. We are approaching the end of our meeting. I would like to thank you for joining us today, and also thank my colleagues from the European Parliament who are committed to the mission of the group. Thank you, Professor Peck and Professor Ricciardiello, for sharing the information. Without information, also for us, a member of the European Parliament, is not easy to work hard against cancer, against coronavirus. It is important, this link between the politicians and the expert in the different sector. You are working, and studies are a fundamental support for us, as I said, legislators. Trend and attitudes clearly show that the burden of the digestive disease is only going to become greater. We need an urgent action to tackle this challenge and improve healthcare for our future generations. This proves how important it is to ensure a continuous flow of information from scientists to politicians. This is a key point. If we want more investment, if we want a strong action, we need to strengthen this link. This is important. For this reason, the MEP Digestive Health Group will be a crucial platform when it comes to improving healthcare and the well-being of people in the EU. The European Parliament has a pivotal role. The MEP Digestive Health Group will be a powerful advocate and will carry concrete actions. We have still a lot of work to do, but I look forward to working closely with this MEP group to promote digestive health and healthier citizens across the whole of the European Union. Thank you very much for your work. Thank you very much for this very important initiative. You will have my support.
Thank you very much, Mr. President. We're very happy to have you on board.
Thank you.